Joe Graney grew up in Delaware and now lives in the Baltimore, Maryland area with his wife, Gail. Joe has led an exciting and fulfilling life.
Yeah, I was in the Navy towards the end of the Vietnam War from 1974 to 1977. And I was discharged and, wanting to get back out to sea. I like the solitude and the traveling and, being out on the ocean. And I signed up and joined the Merchant Marine Union.
Much of Joe's work at that time was centered on engine room responsibilities. In short, Joe made things work. After he put life on the sea behind him, he worked for 18 years in power plant operations at a Baltimore area hospital. Then, one day,
a coworker came up to me and said, "Hey, Joe, they were looking for an operating engineer at the White House." He goes, "Joe, I think you would do good here. Why don't you apply for it?" I said, "Okay, what the heck? Who wouldn't want to work at 1600 Pennsylvania Avenue?" So I applied and had a couple of interviews, and I started at the White House in 1995 as part of the staff with the butlers and the cooks and the maids and electricians, plumbers, carpenters, and us engineers.
Joe worked for 3 administrations: Presidents Bill Clinton, George W. Bush, and Barack Obama. He was in good health through most of his life, but then in the winter of 2014, something happened.
It was a weekend, and I hooked up with a friend of mine where we walk our dogs. And I was walking along, and I said to Fred, I feel real tired, Fred. It was like unexplained fatigue. I said, I have to lay down here in the grass for a few minutes. I got up another 10 feet. I said, Fred, I got to lay back down. And this went on for about 10 or 15 times I had to lay down, from my tiredness and things like that. We thought it was pneumonia. And so I came home, I drove home. I went out to the car and drove home. Just, by the grace of God, I made it home. And I walked in the door right here and I told Gail, I said, I'm so tired, I have to sleep. And she said, "What's the matter?" I said, "I'm just tired, I'll be okay."
What do patients present with coronary artery disease? And it's a tremendous spectrum.
Dr. Gautam Ramani is an assistant professor of medicine in the Department of Medicine in the Cardiovascular Division at the University of Maryland School of Medicine.
I have patients who can't even walk, 4 blocks because of fatigue. And so it's a departure from what's normal for that patient is what makes us concerned.
Cardiovascular disease is on the rise, mostly due to a variety of risk factors, including smoking, too many saturated fats in the diet, high blood pressure, diabetes, and obesity. It is a leading cause of disability and death today.
Some patients may have, some chest pain, some sweats, and they may see their doctor, get a stress test, it may be abnormal, and then go on and get treatment. The presenting symptoms for some patients may be more profound chest pain. They go to the emergency room, they have a heart attack. And then some patients, it may just be what we call sudden cardiac death. They have a massive heart attack, and then they pass out. They have a fatal arrhythmia, and they may not be resuscitated.
After 4.5 hours of not being able to breathe, literally just sucking air for 4.5 hours, how stubborn am I? I said, "Well, listen, guys, it's 4:30 in the morning. I better go up to the emergency room. I'll be right back. I better go up and get some pills, and I'd be a better man." And that's when they took some blood and checked my biomarkers and realized that I was having congestive heart failure, and I was just stunned. What?
The biomarkers Joe is referring to are the blood tests that allow doctors to better pinpoint specific types of cardiac problems and then decide how best to treat them.
So biomarkers are readings and signs and also biochemical substances that are found that reflect the pathophysiology of the heart.
Dr. Robert Christensen is professor of pathology at the University of Maryland School of Medicine. Dr. Christensen explains that biomarkers, or biochemical markers, reveal a great deal about the condition of the heart.
Biochemical markers are found in blood normally, and so what they would reflect is the damage that might be done to the heart.
A biomarker is a measurable indicator of the severity or presence of a disease state. Cardiac biomarkers are measured to evaluate heart function, often referred to in the context of myocardial infarction or heart attack. Cardiac biomarkers are present in the blood after the heart has been under severe stress because it isn't getting enough oxygen. This could mean that a heart attack has already occurred, though biomarker levels can be high due to other reasons. These levels are often used to quickly decide on the scope of a heart attack and the extent of its damage to the heart.
So in general, the amount of biomarkers that are released after a cardiac event are proportional to the amount of tissue that has been injured or has died, actually. While the location of the myocardial infarction is very important as a determinant, in general, the larger the release of biochemical marker, the more injury has been done.
Cardiac biomarkers that are used to diagnose a heart attack include cardiac troponin, which is a protein and by far the most commonly viewed biomarker. It enters into the bloodstream soon after a heart attack. It also stays in the bloodstream days after all other biomarkers go back to normal levels. The American Heart Association refers to troponin as the best biomarker for detecting heart attacks. Creatine kinase, or CK, is a blood enzyme that can be measured several times over a 24-hour period. The normal levels of this enzyme typically double after a heart attack. But because levels of CK can increase due to other conditions besides a heart attack, it is not altogether reliable in the detection of heart disease. CK-MB is a subtype of creatine kinase and is typically more sensitive to heart damage caused by a heart attack than CK alone. Prior to troponins, CK-MB was the biomarker of choice for diagnosing a heart attack. The levels of CK-MB rise 4 to 6 hours after an attack and peak at around 24 hours. They then typically return to normal between 48 to 72 hours. Myoglobin is a small protein that stores oxygen and may be measured while trying to diagnose a heart attack. This is typically done while doctors also check troponin levels. Myoglobin alone is not very specific for detecting a heart attack. Cardiac biomarkers have been used to determine disease state or probability for many years. For instance, cholesterol levels are biomarkers.
It depends on the clinical scenario and what the biomarker is. So if you're in the emergency room and evaluating someone with chest pain, and they have a history that makes you think they may be having a heart attack, and your biomarkers are elevated, kind of suggesting a heart attack, and then all of a sudden it becomes a very sensitive time. You call the cardiac catheterization lab to come in to do an urgent coronary angiogram. So the patient may be having a heart attack. Yep. If the patient's in the clinic and you're counseling a patient who doesn't have symptoms of heart disease but maybe has a family history, may have diabetes, and may smoke cigarettes, and they're concerned about their cardiac risk, you may check this high sensitivity CRP. And then when you talk to them with the results, maybe you might adjust medications, you may change how you counsel the patient, and the doses of medications you use may vary.
CRP refers to C-reactive protein and is a marker for inflammation in the body. An elevated level of CRP in the blood indicates an increased state of inflammation in the body, which can be an indicator of cardiovascular disease. And so, clinical decision-making is largely driven by a patient's particular scenario and by the biomarker being checked.
Cardiac troponin is absolutely essential. It is a cornerstone for the diagnosis of heart attack or myocardial infarction. In fact, the guidelines say that what we monitor is a rise and then fall in cardiac troponin, and this is, like I say, essential for making that diagnosis. The nephrotic peptides are reflective of heart failure. So heart failure causes hemodynamic stress and an increase in these biomarkers. So that would be stress of the entire hemodynamic system. An example would be a fluid overload, in which the heart and vessels they're overloaded with fluid, so it makes the heart have to work harder and therefore puts the heart and the system at stress.
I don't know if it was ignorance or just maybe just a lack of knowing what causes these heart failures. I didn't. Just being a layman, I really didn't know. I do remember them taking blood, and I guess once again that's where the biomarkers came into play. They saw that results of my blood test had indicated that there had been some serious damage to my heart.
So Mr. Graney was actually a very healthy gentleman, had not seen physicians or had regular care, and presented in the wintertime of 2014 with chest discomfort, shortness of breath, and was found to be having a heart attack. He underwent a cardiac catheterization because of the biomarker results in combination with the chest pain he was having, electrocardiogram, all those pointed towards his diagnosis, which revealed advanced coronary artery disease. And then Mr. Graney underwent a heart bypass surgery to try to restore blood to the heart arteries. And so he had a kind of a tumultuous perioperative course. Had difficulty with fluid retention in the lungs, fluid retention in the legs, some irregular heartbeats, and was intolerant of medications, was short of breath with minimal activity. And there was a time where we were thinking whether Mr. Graney may have needed a heart pump, to help his body, or even a heart transplant. And so we made preliminary evaluations in those regards. And given that he had heart failure and had elevated heart failure biomarkers, we enrolled him in our study investigating the use of this BNP to guide our heart failure care.
BNP, or B-type natriuretic peptide, is a biomarker that helps find stress in the heart or detects heart failure after a heart attack. Currently, these markers are only approved as an aid in diagnosis of heart failure, and more research is needed for other indications. As we mentioned earlier, checking cholesterol levels has been a standard test for many years and has transitioned from applying only to those who are at risk for heart disease to becoming a fairly standard test for most annual physicals.
I, for one, believe that this will be a very important role in primary care for the biomarkers, based on the notion that if your cardiac troponin is in that elevated part of the range, that you're at increased risk.
I think there's potential to transform how we care for patients. And so those are things that we look forward to in the future. But there's no doubt that biomarkers have completely transformed how we care for our patients in cardiovascular medicine, specifically with how we diagnose chronic heart failure and how we diagnose myocardial infarction. All right, no problem.
Absolutely feel better. Feel real good. Yeah, I haven't gotten back to my old self, so to speak, is bicycling or ocean swimming or swimming in a bay. And I will. Yeah, I will. Like I said, yeah, I'm really blessed. I feel wonderful.
Yeah.
For more information about cardiac biomarkers, please visit these websites: acc.org, heart.org, and scpcp.org.